Knock knees, or genu valgum, is a condition in which a gap is present between your feet when you stand with your knees together. If you're a teen or an adult with knock knees, exercises and lifestyle changes can help support and strengthen your knees, although they won't cure your condition. For severe cases or if you're concerned about an underlying condition, see your doctor. They may recommend surgical correction. If your child has knock knees that don't correct themselves as they get older, or if they have symptoms such as pain or trouble walking, take them to a doctor for evaluation and treatment. Method 1. Treating knock knees without surgery. Number 1. Try low-impact exercises to strengthen your knees. When you have knock knees, it's important to stay fit and strengthen your leg muscles while minimizing the impact on your knees. Your doctor or physical therapist may recommend low-impact, joint-friendly exercises such as biking, swimming, or walking. Number 2. Work with a physical therapist who has experience treating knock knees. If you have knock knees as a teen or adult, they can increase your risk of developing knee pain, arthritis, and exercise-related injuries. Ask your doctor to recommend a physical therapist who can suggest safe and appropriate stretches and exercises to help strengthen your knees and prevent complications. Number 3. Strengthen your knees with yoga. There are a variety of yoga poses and exercises you can try to build strength, flexibility, and stability in your knees. Yoga is particularly helpful for treating knee problems when combined with physical therapy. Look for a qualified yoga therapist who has experience treating knee problems, or asks your doctor or the physical therapist to recommend someone. They can teach you how to do the poses and exercises correctly so that you do not further injure your knees. Number 4. Do a knee-friendly Pilates workout. You can also use Pilates to strengthen your knees, relieve tension, and improve the mobility of your knee joints. Find a Pilates instructor who can guide you through some good knee strengthening exercises, or ask your doctor or physical therapist to recommend someone. Number 5. Try the Feldenkrais method to improve joint stability and alignment. The Feldenkrais method involves working with a certified instructor to correct the way you stand, move, and use your body. Feldenkrais techniques may be helpful for improving your gait and the alignment and stability of your knees. Search online to find a Feldenkrais therapist near you, or ask your doctor or physical therapist to recommend one. Number 6. Wear well-fitting running shoes to support your knees. Good running shoes can do a lot to take the strain off your knees and ankles, and you can benefit from them even if you aren't an athlete. Go to a store that sells athletic shoes and explain to the salesperson that you are looking for shoes that can help you with your knee problems. They can help you pick out a pair that's right for your specific needs. Number 7. Discuss getting leg braces or orthotic shoes for extra support and gait correction. Your doctor or physical therapist may recommend special shoes or braces that can help correct the alignment of your feet and knees. These devices can also take some of the pressure of your knees, preventing your knock knees from getting worse. Ask your doctor or physical therapist what kinds of devices will work best for you. Number 8. Eat a diet that supports your bone and joint health. In addition to exercising safely and appropriately, you can protect and support your knees by eating foods that strengthen your bones and the surrounding tissues. Talk to your doctor or a dietitian about what foods are best for the health of your knees. Number 9. Work on losing weight if your knock knees are related to obesity. Carrying extra body weight can put a strain on your knees, making your knock knees worse. If you're concerned about your weight and how it might be affecting your legs, talk to your doctor, a physical therapist, or a registered dietitian. They can recommend weight loss strategies that are safe and healthy for you. Method number 2. Number 1. See your doctor for an evaluation if your knock knees are new or severe. If you've recently developed knock knees as a teen or an adult, it's important to see a doctor to figure out what's going on. They can examine you and determine if there's an underlying medical cause, such as arthritis in your knees, a vitamin deficiency, or an injury to the knees. You should also see your doctor if your knock knees are getting worse, causing you pain or making it hard to walk, or are extreme. Number 2. Take medications or supplements if your doctor recommends it. If your knock knees are associated with an underlying medical problem, such as a vitamin D deficiency or rickets, your doctor may recommend taking supplements or medications to treat your condition. Let them know if you are already taking any medicines or supplements or if you have any other health concerns so that they know what they can safely prescribe. Number 3. Look into surgery to correct severe knock knees. If you have severe knock knees that are causing you pain or making it difficult for you to walk, corrective surgery may be a good option for you. Osteotomy is the most common type of surgery to correct knock knees in older teens and adults. This procedure involves cutting out part of one of the leg bones surrounding the knee and adjusting the bone to permanently correct the alignment of the joint. Ask your doctor to refer you to an orthopedic surgeon if they recommend an osteotomy. Method 3. Dealing with knock knees in children. Number 1. Take a wait and see approach for children under 7. It's very common for young children to develop knock knees as the muscles in their legs develop. The condition typically first appears in children between the ages of 2 and 5, and most often goes away by the time the child is 7. While it's a good idea to talk to your child's doctor if they develop knock knees at this age, they likely won't need any treatment. Number 2. Ask a doctor to evaluate your child if the condition hasn't improved by age 7. If your child's knock knees haven't resolved on their own by the time they're 7, make an appointment with their pediatrician to find out if there's an underlying issue. They will likely do a physical exam, and may also recommend other diagnostic tests, such as X-rays or blood tests. Number 3. Treat any underlying conditions that might be causing the problem. Common causes of knock knees in children include vitamin deficiencies and knee injuries. If your child's doctor is able to identify and treat an underlying cause for your child's persistent knock knees, they may be able to treat the issue and help the problem correct itself. Number 4. Find a physical therapist to help your child work on strength and gait issues. If your child's knock knees are causing pain or affecting the way they walk, physical therapy can be helpful. Ask your pediatrician to recommend a physical therapist who has experience working with children with knock knees. Number 5. Get special braces or shoes for your child if your doctor recommends them. If your child's knock knees don't correct themselves by the time they're 7, orthotic devices can be very helpful. Your child's pediatrician or physical therapist may recommend a special shoe or shoe insert to help correct your child's gait. They might also prescribe a night brace, a leg brace that your child wears at night to help straighten and realign the knee. Number 6. Look into guided growth surgery if other approaches don't work. While surgery is not usually necessary to treat knock knees in kids, your doctor may recommend it if your child's knock knees are severe or don't respond to other treatments. The most common surgical treatment for children is called guided growth surgery. Ask your doctor if this procedure is right for your child. Thanks for watching this video. Don't forget to subscribe.